The title of this communication is The Perception of Professionals in the Socio-Health Field about the Support Services Provided for Families with a Member with Neurodegenerative Disease. This work has been carried out by Estrella Montes, Nuria del Álamo, María Picado, Amaia Yurrebaso from the NEUROQUALYFAM group, University of Salamanca, Spain. This research has been developed as a part of an international project funded by the European Region Development Fund. In the Spanish case, the social organization of care is characterized by being family-oriented. This means that the involvement of the family in the care of its members is high in relation to the participation of other social actors, such as the state, the market, or the community. Neurodegenerative diseases are chronic pathologies that generate great limitations and disabilities in the person, and which significantly affect their quality of life, but also the quality of life of their families, precisely because of their high involvement in care. Family quality of life is a multidimensional concept that includes health of the family, financial well-being, family relationships, informal support, influence of values, careers and preparing for careers, leisure and recreation, community interaction, and also support from care services. Families require support services to increase their well-being, and several studies have known the impact that the absence of support services has on the family quality of life. Considering this, the main objective of this study is to find out the perception of professionals working in the socio-health field about the adequacy and sufficiency of the services available to people with neurodegenerative disease and their families in the Spain and Portugal cross-border area. This research has been developed through qualitative methodology. 3 focus groups were held. The first group consists of public social service personnel, in particular 5 workers and 2 community animators. The second focus group involved public health services staff, in particular 6 doctors, 3 nurses and 1 pharmacist. And the third group was composed of people linked to services offered by private initiatives. In particular, 5 workers of association working with people with neurodegenerative disease and their families, and 3 volunteers who support the work of these associations. All of them carry out their work in the Spain and Portugal cross-border area, studied, and had extensive experience working with people with neurodegenerative disease and their families, especially with Alzheimer disease, Parkinson disease, and multiple sclerosis. With the support of the Atlas-I software and following a deductive coding model, the data obtained were systematically coded and interpreted by grouping the information into categories. The results. Initial research results suggest that professionals in the social health agree on their perceptions of the adequacy and sufficiency of support services provided for families with a member with neurodegenerative disease. They consider that, first of all, support services are insufficient and most of them are aimed solely at the needs of the person with a neurodegenerative and therefore contribute little to improve the family quality of life, and they do so only indirectly. The second one, there are services that are considered very adequate for the improvement of the family quality of life. Among them, daycare centers stand out. However, support services considered very adequate are very insufficient in the area studied, and transport problem condition access to them. And 3, the characteristics of the environment, small population, geographical dispersion, significantly limit support services in rural areas. As a conclusion, the support services provided for families with a member with neurodegenerative disease are scarce and inadequate, and therefore contribute little to improve the family quality of life. There is a need to improve access and adapt support services to the needs of families. Thank you very much for your attention.